This segment of Delmarva Life is sponsored by TidalHealth.
Time is a critical factor when treating certain medical conditions such as stroke. You might remember last month when we discussed the Be Fast acronym and how to properly identify the symptoms of a stroke.
Now, one thing that we didn't go over is the role of neurologists, the science that they study, the surgical procedures they perform in order to help their patients with, which is why, by the way, exactly, we have this gentleman, Dr. Emil Bethel. Emil Bethel, did I get it right?
Emil Bethel.
Emil
yes.
Bethel. Bethel. Dr. Emil Bethel. I'm going to say it right. I promise I am. Thank you so much.
It takes time. You're welcome.
Thank you.
Thank you for having me.
So let me ask you this: in the role of what's going on with the patient, what does the neurosurgeon do?
So a neurosurgeon, we're a medical specialty that basically deals with diseases of the nervous system. So our role is to diagnose and treat those disease states of the brain, spine, and nervous system, and all of its supporting structures. And our specific role is in the surgical nature, but we do a lot of treatment other than just surgery, critical care management and medical management of patients who have disease states that we treat of the nervous system.
Okay, so take us along with you. Tell us about a typical day.
Well, a typical day in the life of a neurosurgeon is not everyone's typical day, but it's similar in that, we get up in the morning and we sometimes have coffee and we go to our office, and sometimes we see patients, and sometimes we go right to the operating room. So we have elective days where we're doing elective surgeries, and then there are some days like during the week where we are on call, which means that we are at the mercy of the hospital system and emergencies and so forth. And so we admix those components of our life together in the job.
So you've got to be flexible.
We have to be very flexible.
Now, considering this, is there anything in particular that you usually deal with? Is there a...
So, we split between most people in practice are split between taking care of disorders of the brain and disorders of the spine. Okay. And depending on their subspecialties, some people do more brain and some people do more spine, and we have even greater subspecialties that deal with just children, and some that deal with just vascular disease of the brain and spine, and then some that deal with functional diseases of the brain and spine, meaning like epilepsy and movement disorders. Right. And then there are some people who deal with just spine, and they're considered complex spine surgeons.
Wow.
That's incredible. Yeah. And of course, neuroscience is just going at a breakneck speed as far as advancements. Are there any new developments or technologies that you're particularly excited about?
There's always new developments because, the brain is still being, things are being discovered every day as we get closer and closer to understanding the genetics and the microstructures of the brain. Some of the more exciting things that are going on are advancements in our ability to navigate around the nervous system with neuronavigation. So we're getting better and better with that as our computer technology gets better. AI has taken a great role in diagnostics and helping us with discovering new methodologies for diagnosing and treating patients. Right. And of course, we're getting much better at robotics. And so robotics are taking a huge role in what we do and how we treat diseases of the nervous system surgically.
You have already used some 50-cent words here that I'm like, I think I know where he's going with this. How do you explain... It's a very complex issue. How do you explain that to a patient?
So it's usually very easy to break down, and I always use, my parents were both teachers, and so it's always breaking things down for people to understand. And I use a lot of analogies, like when I'm talking about, well, is my nerve going to recover? Well, it's like parking your car on the garden hose. The longer the car is parked on the garden hose, the more chance there is no water is going to come out of it. But there's a good chance if we take that car off the hose that the water will come back through. So you explain things in basic terminology that not necessarily has to do with medicine, but you break it down for them. I use a lot of models of the spine and the brain to show them in the office what's going on. I give them an opportunity to look at their films like MRIs and CAT scans, and we go over them, and I give them a little basic anatomy class while we're talking about it and tell them what the functions of the things that we're going to be dealing with are. And so they have a better understanding of what their disease state is and how we're going to treat it.
It's also fascinating. Thank you so much, Dr. Emil Bethel, for coming in this afternoon.
You're welcome, and thank you for having me.
My goodness.